Hi. 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 ഞാനിപ്പോ പറഞ്ഞിട്ട് ആൾ റെസ്പോണ്ട്
Granite, go ahead. Inbound 81-year-old female patient with severe onset of shortness of breath on injection.
The modern healthcare industry is divided into many subsectors, depending on the multifaceted teams of trained professionals and paraprofessionals to meet the health needs of our world. From physicians to surgeons, paramedical officers to pharmacists, nurses to managers, administrators to underwriters to medical malpractice attorneys, marketeers to investors and shareholders of for-profit services, all contribute to this fastest growing industry. These professionals provide the best healthcare services for us from primary to secondary and tertiary levels. To improve access, coverage and the quality of health services, World Medical Council, WMC, a non-profit organization designed for the continuous and conscious development of the medical industry, has been initiated. Our aim is to support the field of medicine while developing a close-knit relationship among different medical associations and their related departments. World Medical Council aims to function at local, national, and international level to spread the message of healthy living in our community through its strategic alliances and help advance every facet of the medical industry and reflect its unique perspective to our society. So what does it take to be a WMCN? Absolutely nothing. World Medical Council needs healthcare professionals to come together and contribute towards the advancement of the medical community and help us serve the world. As an associate, World Medical Council will open for you a complete new world with a wide array of opportunities. Through WMC, contribute your share towards development aid, volunteer, and help support the delivery and financing of healthcare services among large segments of the population. World Medical Council invites you to associate with us and spread the message of healthy living, because together we can.
Now, for the keynote address, let's hear from the Vice President of World Medical Council, Dr. Sohan Roy. Dr. Sohan Roy SK is a Forbes-listed entrepreneur and founder, chairman and CEO of Ares Group of Companies. He is the concept creator of EFISM, Efficiency Improvement System Management, an internationally recognized naval architect, Hollywood director, philanthropist, and the founder president of Indiewood Billionaires Club, a first of its kind elite network of wealthy and influential stakeholders.
Hi, good afternoon, ladies and gentlemen, and welcome to COVID-19 Healthcare Excellence Awards. To improve access, coverage, and quality of health services, World Medical Council, WMC, a non-profit making organization, has been contributing relentlessly to facilitate the coverage of professionals and organizations from all cross-sections of healthcare industry, pave way for interaction among the medical fraternity, and promote the vision and mission of each organization among our member community. As you all know, today our world is facing an unprecedented time. Thus, we have taken the COVID-safe approach with this broadcast, with local COVID-safe gatherings taking place to mark this event. While the entire world went into hibernation as schools and businesses were forced to shut down, the medical industry had a very opposite experience. Our frontline workers were the only people, and still are. We had been working day in and day out to keep us safe and secure. Through this stage, I would like to thank all the frontline warriors for their deep compassion, commitment, and dedication shown during these challenging times. COVID-19 Healthcare Excellence Award is a unique online event where We shall recognize the achievements of these outstanding performers and celebrate their success on an international platform. It's been a tough year and we all have been challenged, but I am sure that with this grit and courage, we shall navigate through this. On that cheerful note, I would like to declare this event open. I hope you will all enjoy this virtual event. Thank you.
That was Dr. Roy. And with that, our event is now officially open. Every industry has been facing a tough time, but for the medical industry, these times have been extremely overwhelming. This pandemic explosion has in fact highlighted the importance of the health facility systems and hospitals in the first place, and their constant management as relevant part of the whole governance of this dramatic and complex moment. As the virus still continues to spread havoc on mankind, it's time to reflect on how prepared are we and what steps we can take to mitigate such viral attacks in the future. Today we have with you an eminent panel of healthcare professionals who shall discuss on an extremely important topic: COVID-19 experiences, lessons learned and challenges ahead for the healthcare sector. Before we dive in, let me introduce you to our moderator, Dr. Mohammed Rafiq, Medical Director, Prime Hospital. Dr. Mohammed Rafiq is presently the Medical Director and Head of the Department of Pulmonology and Sleep Medicine of Prime Hospital. He boasts 20 years of experience as Senior Pulmonologist, Chest Physician, working for many JCI accredited institutions in the UAE and abroad. Since taking his post as Medical Director in 2016, Dr. Rafiq has been supervising all medical staff, including doctors and clinical departments, to ensure the application of the highest standards of efficiency and professionalism. Welcome to the event, sir.
Thank you.
Now let me introduce you to the panelists of our session. Our first panelist for the session is Dr. Rajashekar Guju, CEO, Anglo-Arabian Healthcare LLC. He is an accomplished healthcare professional with over 18 years of experience in senior positions at hospitals across India and UAE. Graduated in medicine from NTR University of Health Science, he secured his master's degree in hospital management as well as bachelor in law from Osmania University and postgraduate in medical legal system from Symbiosis International University and a fellow of the Insurance Institute of India. He also has a proven track record of accomplishments in operations management, strategic planning, business development, consultant recruitment and relationship. Welcome, sir.
Thank you very much.
Next, I would like to welcome on board Dr. Shahid Al-Saadi, CEO, Sama Medical Group. Dr. Shahid Al-Saadi has many years of experience in the healthcare industry. Through her extensive experience, she has gained comprehensive knowledge in equity research covering many sectors, including international pharmaceuticals, medical tourism, the regulation of healthcare providers, and many more. Al-Saadi brings with her almost 10 years of experience in private healthcare in the UAE, including executive leadership of the region's largest groups, Noro Al-Saima, Roche Diagnostics, Biorad, Stargo, PSMC, and ASCO. Her experience covers strategic marketing in the MENA region, and her specialties include marketing research within the pharmaceutical and healthcare industries. Prior to joining the Sama Medical Group, she was the General Manager of PSMC in Dubai Healthcare City and Regional Manager for Roche Diagnostics Middle East. Welcome to the event, ma'am.
Thank you so much.
And finally, I welcome Mr. Gopinath Sapnivais, Chief Strategic Officer, Canadian Specialist Hospital, to the discussion. A seasoned management professional with more than 25 years of experience, demonstrated history of working with top healthcare brands in India and UAE at very senior levels. Strong business development professional, skilled in business strategy, brand management to propel growth and brand visibility, operations management, project coordination, and team management. I welcome you to the event, sir. I request our moderator, Dr. Mohammed Rafiq, to kindly take over the session.
Good evening, everybody. Thanks for the introduction and for WMC to come out with such a nice program. And a special regards to our Vice President, Dr. Sohan Roy, for launching such an event in a global platform, namely the COVID Healthcare Excellence Award, and for bringing into a wonderful team of panelists right sitting here with all of you. And I'm very happy to moderate this session, and hopefully we get some insights into how we have gone through this journey over the last 1 year, and how is the way forward, and what are the our experiences as we had faced this pandemic. So without further ado, let me welcome all my colleagues here, Dr. Rajshekhar, Dr. Shahad, Dr. Mr. Gopinath, all of them for this panel. And let us start with sharing some experiences as how you were facing when the first news of this pandemic came. I know it was right from the blue. We thought it was something very far and will never reach our shores. But then eventually one day we all had to face that reality. So can you share your experience on how that was? Anyone can start off.
Yeah, sure. I can start. Thank you so much for this brilliant starting. And definitely, we would like to take the chance to thank Dr. Sopanori for this opportunity and getting the advantage of this event to plan our strategic plans for the future. Being in this world, especially, and facing such a pandemic, which was not expected at all, it's a big challenge. Definitely, because to way pathogenic we have to go through something which is towards the medical industry, and how we have to fight this, and how we have to know what is this pandemic about, especially with no knowledge start and so fast breeding of the pandemic itself, whether it was caused because of a virus which is unknown to everybody until it became COVID-19, named by the WHO, and declaring a pandemic. It was a very critical time to everyone. We have to, in that time, we had to face our fears, and we have to work, and we have to continue to support the medical industry in terms of finding a way to diagnose the pandemic reason, or to diagnose a tool to create how to know that virus about, or to support our continuous economic development and our patient needs and the patients who were enrolled about all of the treatment away from the pandemic. So we had it from the day one that declared as a pandemic to plan strategies very different than whatever we get used to it. Being here, a professional related to a medical health sector, reacting here in UAE, especially, we were very pleased that we have a very powerful structure from the authorities themselves, whether the specialized authority per Emirates, such as the DHA or the DOH or the MOH or the federal authority, which is the Ministry of Health. We were lucky that they had a very far vision, which has made us to act very fast over the pandemic. We were very lucky because we had supplies also to protect ourselves and the frontliner until we had a news and a knowledge how we can diagnose that virus, how we can stop spreading that virus. I think being here in UAE was the best benefit during the pandemic, to have the knowledge how to deal with the pandemic and how to have the protection for our frontliners and to keep the wealth of manpower in the health professional sector, and then how to continue supporting our other patients with the different diseases. Definitely, it was very unexpected thing has to be deal with, but I think if we can stand today to know where are we, it's much better to know and to plan for any things might happen in the future. I will leave the rest of the discussion for my colleague Dr. Raja and Mr. Gopinath. Definitely, they will share a lot of knowledge about.
Thank you. Thank you for the opportunity to speak in this esteemed panel discussion. This is a very important topic. Like Dr. Roy has mentioned, these are unprecedented times, with all the healthcare systems across the world reeling under the impact of COVID-19. Fortunately for us in UAE, with the initiatives taken by the health regulators and the government, we were able to manage the situation far better than many other countries. COVID-19 has brought out the fact that private healthcare facilities have a very important role to play in the public health space. Both public and private healthcare facilities should work in tandem so that the results are very much palpable, like what we have seen in UAE. As a group, having facilities across Dubai, Sharjah, and Dajman, we have been serving the community in this very difficult times. The most important point on which we were working on is tracking the outbreak in Wuhan, which later on became an epidemic and then went on to become a worldwide pandemic. Now, we started following the news once it started becoming an epidemic, and then we internally had a lot of discussions with our teams on how we should gear up if it becomes much bigger, like a pandemic. And then we took some measures very early in trying to gear up our system to cater to the requirements of the community as and when the situation will come up. This includes getting proper stock of the PPEs, the respirators, N95, surgical masks, which we could foresee that there will be a shortage once the general public starts keeping all these stocks with them. Then we went on to arrange the equipment in the hospital. We organized some ventilators, additional ventilators to what we had, and also some CPAP machines, orienting the staff on the protocols to be followed, and also keeping the morale of the healthcare team up, because when the first wave hit us, everyone was very scared of themselves, their families, and how we have to, as a healthcare workers, as frontline workers, staff, how are we going to address the requirements of the community which has come up, and how we should manage the situation. These are all the challenges which we had looking back into 2020 from second quarter onwards. It was a very challenging period. It was very important movement for the healthcare facilities across the world to rise up to the occasion. I'm sure going forward, public health will become an integral part of the outlook of healthcare facilities, especially the private healthcare facilities, which are probably looking at curative aspects of healthcare more often than the preventive and public health related problems like the pandemics. Mr. Gopi.
Thank you, Dr. Raj. Yes, Mr. Gopinath.
Wish you all a very happy new year. Very nice to see you, Dr. Rafiq, again.
Yeah.
Thank you, Dr. Shekhar and Madam Shahad. It's been such a terrific year, which I'm sure like we probably will forget our date of birth, but we'll never forget 2020. It's been terrible, and we were a COVID hospital, and we had to go to tremendous stress and a lot of sacrifices in between. Of course, I would like to address three issues here. I think which I feel that's something very important that we have to dwell upon, which of course will be the current challenges. And the current challenges, if you want me to define this era, I would say like, BC to AD. What I mean to say is it's before COVID and after COVID. Hope to see this AD very soon. But I think as we are still licking our wounds, COVID-19 has really exposed our public and private healthcare, the system inadequacies, and it has brought even the most developed countries to their knees. I mean, we always trusted the West always for any sort of a solution. In fact, they were the worst victims for this whole episode. So I think we have to accept our healthcare systems were not designed to deal with this crisis. Our preparedness to meet any sort of overwhelming requirements is still work in progress. And that is something which we really observed, like, though we had the best experts from all over the world, which we couldn't really deal with this situation. And unfortunately, many of our staff, the frontline heroes, were all victims to this. They were all in the path of the virus, and they were all victims. What I suggest is a sort of a three-pronged approach. I think this healthcare sector, looking at the whole scenario, it needs a complete structural overhauling, which I think it's a sort of a mandate that we have to follow. The focus, I think, should be during this COVID would be more to have an organized and a very conscious approach towards, first is cutting down on sort of a direct cost, which has really impacted our businesses too. Other than, always we were getting into a sort of a firefighting mode, but we were also parallelly going through a huge financial crisis. This is one area that we have to really address. And the other thing that the learning that we had was we, as what Dr. Shekhar rightly said, is that we don't stick on just to private health, but also learn to deal with the public health, which is very, very important. And I'm sure like it had significant impact on the healthcare revenue cycles also. Issues surrounding patient financial perils and job cuts, stigma visiting the hospital due to safety factors. And we may have to just postpone most of the surgeries and all that. So there is a huge pileup, and we are in a sort of a situation. Once we became non-COVID, we are definitely in a sort of a different scenario where to deal with it. I think this COVID pandemic will have a long-term impact on healthcare system that should be addressed by political and healthcare authorities as soon as possible. The government should also help the bleeding industry with waivers and some sort of a reducing interest loans to cope up with the current situation. And it's also very essential that we have very strict controls on our cash flows. I think that should be the way forward. And of course, our focus this year, and I'm sure like for the next few years, will be more towards the telemedicine. And we are seriously working on to improve the telemedicine and probably just the home care. And we're also in the process of introducing mobile clinics because I'm sure like that's going to be the future.
Thank you, Mr. Gopinath. Thank you. And I agree that this pandemic has put in a lot of challenges. And all of you have mentioned the challenges in different angles which you have perceived, right from the financial angle, from the clinical point of view, how the technology has played a major role and how it is going to redefine medicine in the future. This is something which I would like to know from all of you, because until then we never thought of telemedicine, telehealth, teleconsultations, which was something new, because people also were a bit scared to come to institutions and to healthcare providers because of this virus around. So what happened is DHA also came in quickly. They started tying up with insurance companies and telling them, giving them authorization to approve telehealth services, which was a landmark change actually. And telemedicine quickly can spring in places, not only here, in various parts of the world. And still people are comfortable going for telemedicine. And I think that would also be the way forward till we come out of this pandemic completely. So as we discussed on the financial impact, which is very well known in various sectors, because at some point surgeries were on hold, and later, with a bit of screening processes in place, the surgeries were reinitiated. So I know that was a time when the financial impact would have affected institutions. And of course, the second thing is the areas which got affected, like some pediatrics. There are some departments where there's a lot of resistance to for patients to move because of the vulnerable population. And one more thing, what I found is this: during this pandemic, there's been a lot of media coverage. Do you think that we did have the MERS, we did have coronavirus a couple of times before? If you remember, exactly 5-6 years back, we had the MERS coronavirus, which was also belonging to a similar category, but more regionalized, more towards the region. So what do you think stood out in this pandemic? What was more different? Like of course, that was not a pandemic; it was an epidemic. What could have been the differences? Why it became such a big awareness issue? So I would like to know your thoughts on this also. Please go ahead.
Thank you. So we have seen some swine flu, we have seen MERS, we have seen epidemics, but not to the scale of a worldwide pandemic. The differences between those problems and the current one is the kind of transmissibility of the disease and how it is impacting, the kind of segments in the population, the age groups which are affected. There is a significant impact. I want to mention this particular point that 2020, I have been sending so many condolences messages in place of many birthday wishes. So everyone is impacted. Every person, whether they're a family member, they've lost a family member, or they lost someone very close. Unlike the other epidemics, what we have seen, this has impacted all the people. And we are in the midst of the second wave, and we have seen how the Western world is really reeling under this pandemic at this point of time. It is actually a tough time, and we have to see through this. It is an unwanted situation, but again, it is a major disruptor for healthcare. It has brought in so much of push to how we approach healthcare, and I'm sure in the next few years, the healthcare will not be operating the way it was operating before. The implementation of technology, whether it is telemedicine or any other technology innovations which are going to come, the healthcare space is going to be different in the coming 5 years.
Agree. I share with you, Dr. Raja and Dr. Rafiq, and whatever you've been highlighted. I would like to highlight one important thing, which is different than the before spreading of any viral attack that we face, whether MERS or SARS, or even the Spanish flu, which started in 1920. The world and the humanity was not prepared at all to such a pandemic. This point, I think it's come from the poor research of the World Health Organization, if you can say, or the definite, a lot of bodies and institutes that were very away from the researchers. So the poor research does not help us to predict whether it's going to be another pandemic in the future. Definitely, it's not unpredictable, but again, if there is a very good research which is encouraging the community towards the hand hygiene, maintaining a physical distance, even you are healthy. A lot of concepts has come due to that pandemic. I think the world is changing for the next 50 years by taking the advantage of having a technology in our life. Lastly, the patient has came to convince himself that the face-to-face consultation is not required. So again, we are saving time, we are maintaining minimal contact with the patients, whether it is a COVID-19 or any such viral infection. And you know, the virus is unlimited. There is no need for the patient to come unless he has something very emergency or very serious to attend the doctor consultation face-to-face, or even in a surgery. As you are aware, all of you, there is a new techniques even with the surgical ward inside the OT. There is a robot coming to do a surgery, so the life is changing toward the technology. And we have to implant the technology as fast as we can in all the sectors to maintain the best benefit to all of the patients and the efforts for the doctors, especially during the pandemic. A lot of countries has declared that they are in lack of healthcare workers, and the numbers of the graduated healthcare workers, or the doctors, or the nurses, or the medical technicians, even the radiologist technician, they are very less than the humanity. they are serving. So if we wanted to improve, definitely we have to enroll a lot of programs which is supporting the researchers, the future researchers, and to implant more of the medical staff, even the supportive staff. In this pandemic, I think everybody has realized that the first defender is not the doctor only. There is a lot of supportive staff has to be there. The world numbers and statistics for the nurses and the technicians and the anesthesiologists and the other players, which is they were behind the scene. We were not evaluating their efforts. It will be changed in the next years for a definite. The people themselves, even with the pandemic, the encouraging of getting a better hygiene and experiencing the distancing that they were doing, it's minimizing the other diseases that we were facing day to day. So that means even it's a very difficult time for all of us. Maybe we're away from our families, we doesn't have a chance to celebrate the holidays, we doesn't have a chance to gather in Ramadan or in the Christmas Eve, we were not able to fly anywhere. But again, all of these happen for a reason, which is we have to take the advantage for it in the next year definitely. The most important things to be evaluated now, whatever that Mr. Gopinath has mentioned, the disaster management and the crisis management, how we are prepared to face any type of disaster, whether it was a medical pandemic or it is an earthquake or it's a fire or any nature anger activity might happen. We have to be prepared from financial perspective, from stock management, whatever have been suffered in the other countries, from the masks and from the N95 and whatever. The industry of healthcare has to be improved in the years to be sufficient for all the people who might suffer from these type of problems. And of course, the education, continuous education program for the communities to know more how life is valuable for each one of us to stay away from the bad practice they might do. And sometimes, even while traveling, they have to be more aware. And maybe the mask is staying with us for a long time, even there is a way out.
I think Dr. Shahad and Dr. Shekhar has said it all. But according to me, I think the SARS or the MERS that we are talking about, it was more localized, and it was more in Africa, and luckily it was not spreading, or it didn't have that scale where I think they had most of the checks intact, and luckily it was not it didn't turn it into sort of an epidemic like what we are seeing now. Mm, but I think now it's a huge lesson to all of us, and I'm sure like with all the technology, with all the learning, and I'm sure like we have enough research data also to bring most of this thing into control. And in fact, like in one of our meeting, we were suggesting that we should also have some sort of a epidemiologist as part of the team henceforth, because I think future we got to be future ready, and this is a great learning. And I'm sure like this COVID is not going to disappear now; it is going to remain. But probably what might happen is like once the vaccination gets into effect, and definitely there might be some herd immunity, but we should understand it might turn into a sort of a flu. It might be a low graded, but this is going to remain with this forever. So until and otherwise now, since we are seeing new strains and all that coming into, like we are actually seeing the second wave, or probably there might be a third or a fourth wave, and hopefully we don't reach to that level. I'm sure like most of us will be vaccinated, and things will be under check. Until and otherwise there is something new which is not going to come into the market. I think now to large extent we are ready. We are ready to meet up, and the house is put in order, which I'm sure like just matter of time that we can say bye-bye to COVID.
Yes, I agree with all of you that compared to the diseases we had before, infectious disease, this has been unique. As you had mentioned, a couple of things. One is the rate of infectivity is much higher, and the second thing is the awareness. The media awareness also has been on a very big platform. Like everywhere, at one point you find the search engines were only showing searches for related to COVID. And of course, air travel. This is another aspect which, in this present era, the connectivity, quick speed at which disease happens in one continent transmits to the other continent. This is another area where the borders were, of course, closed, and but this connectivity also had contributed to this large issue. But having said all this, we are really blessed in this part of the world with the initiatives which the government has come over. The moment they found this is coming in, they started putting guidelines, they started alerting hospitals, and there was a lot of funding coming in from various angles for the healthcare industry. And the guidelines were kept on revising. Every 1 week you used to have a new guideline. And then the medications were also, as you know, were given by them to treat. So I think that public-private partnership was one model which they employed. That was a good idea. And the second thing was their quick initiation of actions, which naturally included guidelines, medications, infection control policies like hand hygiene, awareness to the public, news report, media reports. So I think there's a lot of things which has gone, and sanitation drives. I know we, at one point, we cannot go out of our homes after 8 o'clock or 9 o'clock. And even the clinics, we had to modify clinics and the working hours just because the staff couldn't go back or come in. So I think there's a lot of things which we are lucky that this part of the, in this part of the world, we had been blessed with compared to many other areas which were reeling right now and still under the pandemic. So apart from this, now there's a lot of hope. As you all know, there is vaccinations coming up. And once again, the governments have been pretty right on the front to see that the population is more than happy to get it vaccinated. 2-3 options. Can you share some thoughts on how this vaccination concept is going on in your institutions? What, do you have any challenges in this? Because now we are facing a lot of hope with vaccination coming in, a lot of research coming in, and I'm sure there is more vaccination going, more vaccines in the pipeline for us. So I think the picture would be more rosy, more optimistic with these coming in, and with the drives, the amount of drive which immunization drives through all layers of the population. I would like to hear from this esteemed panel on your thoughts on this, please.
Dr. Rafiq, I think, as you said, I'm sharing with you, again, we are lucky to be here in this part of the world. The national authorities here and the disinfection control, which has happened very early, it's helped to contain the pandemic here in UAE especially. And in general, again, we are taking the big opportunities and chances, maybe different than other countries, that we have this variation in the vaccine. Definitely, the research is still poor to improve that impact of the vaccine or non-vaccine for the people who are still suspecting whether they will go for a vaccine or no. But definitely, we have to go for a vaccine. It's not an option. As per to my perspective, whatever I'm talking about, from points that getting the vaccine is a very big chance to at least minimize the disorders that might face you if you get a normal the COVID-19 in a normal way by getting it from a normal infection. The variety of the vaccine, I think, is the best thing happening right now, because there is a lot of institutions trying to improve their material, their research, and they are, of course, definitely are defending such a point that where they make these vaccines, and having them all available here in UAE is a good chance also for the community to select which one they go through. Definitely the approvals that it has been taken by the local authorities, giving the approval certificate and the green line for all of these companies to participate their vaccines here in UAE, it's a huge thing happening and so fast because of the national structure and the authorities body that's here and the accreditation body who's giving the approval very fast. It's coming from very deep point, and definitely there have been a lot of research and supportive document has been approved by the national authorities used to start this vaccine. I think it's not the end of the pandemic having vaccine, and we are speaking about a very, I think at least 2, 3, 5 years from now, in order to have the enough research and the enough vaccine, and maybe different vaccines will come, especially with the new strain and the mutation happening on the gene level of the other countries, being open in traveling between the countries and transferring a different stains of the COVID itself, I don't think it will stop here. So taking the vaccine is important thing that we are recommending to all of the people who's watching us maybe, and our beloved one. We would be happy to have the vaccine so soon. Maybe some of you, my colleague, has received already the vaccine like me, but I will encourage you definitely. But the vaccine is not the end of the way. So everybody's taking the vaccine has to look into maintaining the distance again and wearing the mask. There is a lot of public things coming with it, which is with the social media platforms or in the general topics, and even between family and a friend who are taking the vaccine. So there is no need for a mask, there is no need for a whatever. That's definitely wrong. They have to take the vaccine, they have to look into themselves. There is still research is coming on, there is a lot of vaccine, and there is a new strain that's a definite. So from my perspective, I see talking about the vaccines very positive things that the whole community has to go toward it. Everybody has to maintain his immune system. We have to practice the same precautions that we are taking until at least a declare from the WHO to minimize the level of pandemic, or if there is a country is recovering, especially in this critical time, still the COVID cases getting increased more and more in the whole world.
So on vaccination, we started administering the vaccines in our facilities in Northern Emirates, and the response from the community has been extremely positive. We have a lot of people who have already availed the vaccination at our facilities, and a lot of people are requesting for the vaccine. I think it is very important to point out here that UAE has taken a very good initiative to bring the vaccines much earlier than many other countries and administer them to the population and give them the protection. And the leaders have shown their way, which motivated the population and the community to go for vaccination and seek the protection. I'm sure in the coming few months, we will be able to vaccinate a lot more people, and then we can see probably the effect of COVID-19 pandemic gradually coming down.
Yeah, I stand with what the panel has been saying. But what I feel is, though it's been called as a fast track vaccine, but people, it is very important that people should trust science, people should trust God and go for it. And I think, as rightly said by Dr. Shekhar, is that is the leaders who have actually shown us the direction. They were actually holding the baton for us. And it's like we always believe in the leaders, and I'm sure like to large extent people followed them. That's a sort of a huge relief and a huge trust that they had on our leaders. Number two is that I think what is very important is the media shouldn't give mixed feelings, mixed theories. So it's the media who was actually creating the unnecessary fear in people's mind, and people are generally pushing it to see, wait and watch. Which is totally wrong. I think the government has been so good, and they are just giving it free of cost with so much of effort. And UAE is such a wonderful country. We are so blessed to have the vaccine first before most of the people in the world have seen it. And I think everyone should jump into it. People should believe in our science, and we should go for it. And I think, going in a war, there are always a few soldiers die. That's fine, but you are actually saving the whole generation. I think that should be the spirit. They are also very clear that, even it is very well defined that it's a frontline heroes who are so exposed to have it. And luckily, in our institution, we have made it a sort of a very sort of a mandate, and where we had most of the people vaccinated, and though though the surge is happening, I'm sure like just matter of time where we see the surge going down. And I strongly believe that people should go for it, and the media should definitely support. And these so-called the celebrities that we have, this is the time that they have to wake up and ensure, they motivate people to go for it. And they should be the first people to hold the baton. They should go have it and stand as sort of to set a precedent for others to go and have it.
Well said, Mr. Gopinath, and same opinions of Dr. Raja and Dr. Shahad. We all agree that the way forward is bright, and with the advent of vaccination, and if you're able to get around 60% plus of population having antibodies, then we have achieved herd immunity. Once we achieve herd immunity, the viruses don't have a host to cling on to. So just like any natural disease which has happened in the past. So hopefully we look forward to that day. I know it is not today or tomorrow, it takes a bit of time when we reach there, and that would be a turning point when we think about COVID as a past experience. We look forward for that. And once again, a very valuable inputs from this wonderful team of panelists. And I think hopefully we are able to give you some very useful insights, our experiences, the challenges we faced in healthcare, and the way forward in the coming few days. So thank you very much for all, and for WMC for organizing this beautiful program. Thank you.
Thank you for your wonderful moderation, Dr. Rafiq.
Thank you,
Welcome.
Dr.
Thank you. Thank you.
Thank you all for that intriguing discussion. Now let's move on to the most awaited and exciting part of our event, the COVID-19 Healthcare Excellence Awards 2021. Our first award category honors individual achievers, and the first award in this category is Frontline Medical Heroes, and the winner is Dr. Mahesh Kumar Arora. Dr. Mahesh Kumar Arora is a 63-year-old Indian anesthesiologist who had been unconscious for 2 long months as he battled COVID-19. He's just not a survivor. For doctors, he's a medical miracle. He was the second patient in the UAE who had to be transferred on the ECMO machine, and the first one did not make it. He has indeed defied death, and his survival story has left many in disbelief. Dr. Mahesh Kumar Arora recently joined Department of Anesthesia at Lifecare Hospital, Musaffa, and earlier he was a professor and head Department of Anesthesiology at AIIMS, New Delhi. He has nearly 40 years experience in specialty of anesthesiology with an advanced training in anesthesia at McGill University Healthcare, Montreal, Canada, where he got special training in anesthesia for liver transplantation. May I invite Dr. Mahesh Kumar Arora to speak a few words. Dr. Mahesh, requesting you to kindly switch on the audio. The video as well, please. Kindly bear with us a few minutes. Dr. Mahesh, can you hear me?
Yeah. Hello, good evening, ladies and gentlemen. I thank the jury for selecting me for the prestigious WMC COVID-19 Healthcare Excellence Award. First of all, I would like to thank the Almighty for His kindness and blessings. I take this opportunity to thank my whole VPS family and under the dynamic and inspiring leadership of Dr. Shamsheer and the management, as well as my all colleagues, nursing and paramedical staff of Lifecare Hospital Musaffa, Burjeel Hospital Abu Dhabi, and Burjeel Medical City, who helped me to come out of this ordeal with their unstinted support. wishes and blessings. Last and not the least, I would like to thank my family for their continuing love and support. Thank you very much.
Congratulations once again, Dr. Mahir. We have one more winner in the Frontline Medical Hero category, Dr. Mohammed Rafiq. Dr. Mohammed Rafiq, the medical director of Prime Hospital, brings 20 years of experience as a pulmonologist in internationally accredited facilities by JCI, Joint Commission USA, and ACHS Australia in both government and private sectors in Dubai and India. He is a COVID task force key frontliner in clinical front as pulmonologist and administrative aspect as medical director and chair of infection control for Prime Hospital in pandemic, and has received appreciations from DHA for COVID frontliners. He has also received the COVID Warriors Shukran Badge and appreciation letter from His Highness Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum. Let me invite Dr. Rafiq to share a few words.
Thank you. Thanks to the jury for honoring me with this award from the World Medical Council. And I would appreciate this kind of events, which gives a lot of confidence and appreciation for frontline workers. And I have to be grateful to God and to the Almighty for taking us through this journey where we managed to treat quite a lot of patients along with our excellent team in the hospital, and to our COVID task force, to our managing directors, and for laying the way forward strategy, the vision to come into and managing this pandemic at a very appropriate time. So thank you once again, everyone, and all of the healthcare professionals who have for their unstinted efforts during this time. Thank you.
Congratulations once again, Dr. Rafiq. Our next award in this category is Women Personality Award, and the winner is Miss Renju Jo. Ms. Renju Jo is one of the senior staff in VPS Healthcare, holds position as Regional Nursing Director, Musafar Region. She has more than 15 plus years of experience in nursing and nursing administration, is efficiently handling nursing services and clinical services in Musafar Region through LLH hospitals, life care hospitals, and their medical center. Her contribution to COVID management was commendable, which includes setting and managing up COVID-19 screening, field hospitals, vaccination programs, and etc. Ms. Renju, please share a few words with us for our spectators.
Good evening. I'm extremely honored to be receiving such an important award. I'm grateful for this recognition. I sincerely thank my management for nominating me for this award. I really dedicate this award to my team who worked with me throughout this COVID-19 crisis. Thank you.
Congratulations once again, Ms. Renju.
Thank you.
Moving on, our next award is Healthcare Personality Award. Dr. Raza Siddiqui is the winner. Dr. Raza Siddiqui is the Chief Executive Officer of Arabian Healthcare Group, AHG LLC, a promising healthcare initiative undertaken by the government of Ras Al Khaimah. AHG has been established as a premium global healthcare management firm, excelling at developing state-of-the-art hospitals and integrated healthcare solutions. Dr. Raza Siddiqui has established himself as one of the most renowned names in the healthcare and hospitality sector in the UAE. Dr. Siddiqui began his career at acclaimed pharmaceutical companies such as Ranbaxy and Lupin Laboratory. Since then, he has climbed up the corporate ladder at a remarkable pace and now heads the Arabian Healthcare Group, a premier group with RAK Hospital as its flagship brand. Dr. Siddiqui has been in the UAE for over 15 years now, pursuing his ambition of creating a global niche of premium healthcare with premium hospitality. Congratulations, Dr. Raza. Kindly share a few words with our audience.
Thank you very much. Thank you very much, World Medical Council, for this recognition. I accept this with all humility on behalf of the Arabian Healthcare Group and RAK Hospital team. We have had a very good discussion under the leadership of Dr. Rafiq But one thing I would like to highlight on this forum, that there was a time when there used to be a phrase called customer first. But now things have changed, and with COVID, it is more employee first. So it is the employees, it is the warriors who have made it happen and who have delivered. So I would like to share something which is very important, and all of us have something to learn from this. We were the only hospital who is testing now every employee every week to keep their morale alive. And we have created the 30-bed quarantine center to keep our staff in case they get infected. Not only them, their families and their apartment members. So it is very, very important to take care of the people so that they can manage our patients. Because we have learned from the Bhuj earthquake accident that the facilities which were supposed to provide healthcare to people also collapsed. Here, the challenge was the morale of the people. So I think this is very important what you are doing, recognition of the people who have made it happen and who have helped us in delivering good quality care in these difficult times. So thank you very much.
Thank you, sir, and congratulations once again.
Thank you very much.
Our next set of awards is to honor organizations in the healthcare sector. And the first award in this category is Excellence in CSR Contribution. We have two winners in this category. Our first winner is Life Care Hospital. Born out of a desire to provide cost-effective yet specialized and superior quality healthcare services, Life Care Hospital is complemented by personalized care and individual attention to each patient with an unparalleled passion and commitment to serve the medical needs of the growing population of the Emirate of Abu Dhabi. Their plan is to become the hospital of choice to citizens and residents of UAE through the dedication of their doctors, nurses, and paramedical staff in attending closely to each of their patients' medical needs with compassion, respect, and dignity. Let me invite Dr. Narendra Sonigra, Director Operations, to share a few words with us.
Thank you very much, WMC jury. This award means lot to us. Thank you. We received this particular award with great humiliation from our side. I would like to say this particular award is a contribution of all the hospital staff across, I think, 1,500 staff who is associated work hard in order to achieve this particular juncture where we are probably, we can say, we are far more safer than what we were. This award, this recognition will definitely motivate all the staff associated with the hospital. We even would like to say thanks for Government of Abu Dhabi, Department of Health, for taking so much of proactive effort by reacting to the situation, by setting up various fever clinics, screening centers, vaccinations. Now we have started, so it's an amazing journey which we have gone through with very tough time, and now we are very happy. Now situation has come where we started vaccinating the people, and we are seeing we as a healthcare have saved many people's life. More or less, I would like to say, okay, the nursing team and clinician team were the superhero in this particular journey. But I would also like to say, I think the people like housekeeping, facility, biomedical team, they work tirelessly to make sure hospital can able to cater the services to the COVID people. So I once again thank you wholeheartedly to WMC for recognizing us. I would like to say thanks to all our teammates who contributed so well for the community. Thank you very much.
Congratulations, Life Care Hospital. The second winner in the Excellence in CSR Contribution category is Mediq Healthcare Group. Mediq Healthcare Group understands that healthcare services are extremely important, especially at this time of pandemic. That's why they have well equipped themselves in terms of up-to-date equipments to fight COVID-19 pandemic and other health-related issues with their top services. Mediq Healthcare Group came up with a specialized COVID-19 hospital with 200 beds, having an intensive care unit, ICU, in just 15 days on the face of the pandemic. Congratulations, Mediq Healthcare Group. May I invite Dr. Chandrasekhar Jadhav, VP Operations, to share a few words for the audience. Dr. Chandrasekhar, can you hear me? If you could kindly unmute yourself, sir.
Yeah, now you're getting?
Yes, sir. Now we can hear you. Please continue, sir.
Yeah, I'm really thankful for the World Medical Council for this wonderful initiative and recognizing the organizations working in the positive spirit. I, on behalf of the Medicu Healthcare Group, really thank from the bottom of my hearts. We, the Medicu, were the first entity under the leadership of Mr. Bidhan Chaudhary, our group CEO, were invited by the government of UAE to fight against the COVID-19 and carry forward the baton. We conducted 8 screening centers, 17 quarantine and isolation centers, and most importantly, 5 field hospitals, which were indigenously conceptualized, implemented, and proven to be effective in terms of quality, with efficient resources also. Collectively, I can proudly say that more than 66,000 of patients have been treated in our hospitals in the care. I really thank and accept this award with much humbleness on behalf of the thousands of the staff who have been associated with us, and also the government and the leadership of the government who have been such a benevolent and supportive for eradication or controlling the COVID-19. Thank you.
Thank you, sir. Congratulations once again.
Thanks.
Our next award is Excellence in Leadership, and the winner is RAC Hospital. RAC Hospital is a multi-specialty hospital located in RAC, United Arab Emirates. It was established in 2007 as a joint venture company between the government of Ras Al Khaimah under the patronage of the ruler Sheikh Sakr Al Qasmi and the ETA Star Healthcare of Dubai. They have received various awards for the world-renowned medical professionals working in a state-of-the-art infrastructure, ensuring the well-being of their patients. RAC Hospital is also actively joining hands with the government of UAE and the Ministry of Health and Prevention in achieving rapid immunization of the UAE population. Let me invite Dr. Raza Siddiqui, CEO of Arabian Healthcare Group, to kindly speak a few words.
And the entire team for selecting RAC Hospital. RAC Hospital was the first hospital, amongst the first hospital in Northern Emirates to start COVID PCR screening. And we are really blessed to be in this country, which was not rated so high on the world map of healthcare, but the way the entire private and public sector have come together and managed it so beautifully that it has become a role model for entire world to follow. RAC Hospital, the entire team has played a very important role in not only screening, but providing quality healthcare for the residents of Ras Al Khaimah and the Northern Emirates. Thank you very much for the recognition of this contribution.
Congratulations, RAC Hospital. Moving on, our next award category is Excellence in Healthcare Technology, and the award goes to Canadian Specialist Hospital. Canadian Specialist Hospital is one of the largest private hospitals in Dubai and the institution of choice for referrals from small and medium-sized medical centers that lack some of their specialized diagnostic and treatment facilities. CSH has grown to become one of the most advanced and comprehensive healthcare institutions in the region. Its mission is to offer state-of-the-art diagnostic, curative, and rehabilitative services of international standard and to render comprehensive genetic and prenatal services with evidence-based ethical healthcare for a healthy and happy community. Let me invite Mr. Gopinath Sabniwais, Chief Strategic Officer, to speak a few words.
On behalf of my chairman, Mr. Abu Rashid Al Falasi, Canadian Specialist, I would like to take this opportunity to thank the World Medical Council and the jury for this recognition. This recognition during these challenging times has made us really stronger. Thank you so much. And we would like to dedicate this award to our nurses, doctors, and all the frontline heroes in this world for their immense sacrifices, invaluable dedication, commitment, and the unwavering efforts in managing COVID-19, oftentimes risking their own lives for the benefit of the nation. saying that together we'll win this battle against COVID-19. Thank you once again, the jury and the World Medical Council, for this recognition. Thank you.
Congratulations once again, Canadian Specialist Hospital. Excellence in Community Involvement is our next award category, and we have two winners for this category. Our first winner is Meteor 24/7 International Hospital. Meteor International Hospital introduces a new concept of healthcare that combines medical superiority with five-star hospitality, believing that patients want more than just treatment. They want superior care and personalized attention. Their team of caregivers are handpicked from a pool of talented multi-specialty healthcare providers, offering specialty care at every stage of the patient's experience. On one hand, the elegance and advantages of the premium luxury facility will exceed patients' expectations, whilst on the other hand, their ethos and science behind the healing will provide medical care that is second to none in the district. I request Dr. Asif Ghani, Director of Operations, to kindly speak a few words. Dr. Asif, I request you to kindly switch on the video and the audio, please. Dr. Asif, can you hear me? Dr. Asif? Moving on, the second winner in the Excellence in Community Involvement is Ahalya Hospital. Ahalya Hospital Musafa is a tertiary care multi-specialty hospital excelling in providing the best of patient care. This hospital is a part of Ahalya Medical Group, a group which was established in 1984 with the vision to provide ethical and state-of-the-art healthcare in Gulf. The Dream Care Hospital in Musafa blossomed from the trust received from the patients who visited the Musafa Medical Clinic, which was started 22 years ago, offering the best of the service for the customers around the region with minimal amenities. May I request Dr. Ashik Zinda, Medical Director, and Mr. Lorna Berner, Manager, Medical Administration, to kindly speak a few words.
Good evening, everyone. I'm Dr. Ashik Zinda, the Medical Director of Ahalya Hospital, Musafa. On behalf of our Managing Director, Dr. V.S. Gopal, we are extremely honored to be receiving this prestigious award from the World Medical Council. We also thank the World Medical Council for recognizing our efforts during the COVID pandemic. As you all know, we were going on quite smoothly in January and February, and suddenly the pandemic hit us at the end of March. And we panicked initially, but then we regrouped. And I'd like to extend my sincere thanks and sincere congratulations from the bottom of my heart to each and every member of the Ahalya Medical Group for what they did in pulling us through this situation. Right from the extremely dedicated nursing staff to our general practitioners, to the internal medicine specialists, to our pulmonologists, to the anesthetists, to the ICU intensivists, to the radiologists, and the lab technicians who helped us get through this phase in a timely manner. We'd also like to thank each and every staff in our allied healthcare services who also helped us to push through these difficult times. Now the vaccination is upon us, and hopefully that will bring us into a much better light. And there is probably light at the end of the tunnel, but we're still not through. And we hope that the UAE healthcare sector together, along with the efficient leadership of the UAE and the Department of Health and the Health Authority, will actually pull through this situation and help us get through this. Thank you very much.
Thank you. And can we hear from Mr. Lorna Berner, the Manager, Medical Administrator as well?
Good afternoon to all. Yeah, thank you WMC for this recognition. And COVID means it is very personal to me because I was one of the first batch of staffs in our group to get COVID positive. And I was admitted to the hospital for almost 12-13 days. And I had to wait almost 1 complete month for me to report to my office and come back to my normal activities. Anyway, majority of the gratefulness and thankfulness has already been said by our medical director, Dr. Rashid. Once again, thank you very much, WMC, for this recognition. And this is truly a, what do you call, a strong support and an energy which we have received in our continuing path of serving the community and fighting for the COVID-19. And once again, thank you, WMC. Thank you, Ahalya Group, for nominating, and especially we represent our Honorable MD, Dr. V.S. Gopal, for all his visionary efforts and supports and caring which he has extended to the staff and the community. Thank you very much.
Thank you, Mr. Lorna. Congratulations to Ahalya Medical Hospital once again. Excellence in Home Healthcare Services is our next award category, and we have 2 winners for this category. The first winner is Manzil Healthcare Services. Manzil Healthcare Services is a digital health company built on clinical expertise of home healthcare and disease management, providing individualized care and programs. Manzil Healthcare Services is the first standalone home healthcare company internationally accredited in the UAE in 2016 and 2019. Manzil employs approximately 360 plus staff, inclusive of DOH, MOH, and DHA licensed nurses, physicians, and therapists in the UAE, and licensed nurses in Egypt, Qatar, and Kuwait. They have carried out commendable work in the home isolation and home quarantine projects offered by the Department of Health and Abu Dhabi Public Health Centers during the pandemic. Let me invite Mr. Yasir Qureshi, UAE Country Director, to speak a few words.
Thank you very much. Thank you very much, the World Medical Council. I would like to thank you for this recognition and the recognition to all health workers and frontliners in this pandemic time. As a home care, we have faced with all the healthcare providers these challenges. The healthcare workers were on the street where everybody was at home during the curfew and the lockdown. So I would like to really thank all my colleagues. I would like to thank all the healthcare workers and the DOH, especially for involving us in the DOH isolation project and the home quarantine project, and accepting us as a part of UAE response. We are very lucky to be in UAE and to be actually pioneer in the response for the COVID-19 worldwide. Thank you very much again for this award.
Thank you, sir, and congratulations, Manzil Healthcare Services, once again.
Thank you.
Our next award winner in the category is Al Zayarat Home Healthcare Center. Al Zayarat Home Healthcare Center is a leader in delivering excellent home healthcare services. They aspire to fulfill the mission and vision in transforming home health by providing high-quality, technology-enabled, multidisciplinary care to patients in the comfort of their environment. I request Mr. Paul Joseph, Managing Director, to kindly share a few words. Moving on, now for our next award. It is being awarded for excellence in patient satisfaction, and we have 3 winners for this category. The first winner is Burji Royal Hospital. Located in the heart of Al Ain, Burji Royal Hospital offers all-round expertise ensuring the best in diagnostic, curative, as well as preventive aspects of healthcare. Equipped with the most modern advanced facilities in treatment, equipment, and diagnosis, and with a team of renowned specialists and medical personnel at the helm, Burji Royal Hospital is setting a new standard in healthcare in Al Ain. Let me invite Mr. Suhail Saheed, Director of Operations, to kindly speak a few words.
Hi, good afternoon to everyone, and thank you very much to World Medical Council for choosing Burji Royal Hospital on patient satisfaction category. With Burji, we always aim at patient satisfaction, whoever comes to the hospital. So even at the difficult time of pandemic, we always try to make sure that the patients who walk into the hospital or come to the urgent care are happy with the service and satisfied with the care and the healthcare service which we have provided. Thanks to the the leadership and the visionary of our chairman and managing director, and the staff and everyone in the hospital for achieving this, our goal of providing the best care for the patients. Once again, thank you very much for choosing Burjul Royal Hospital. Thank you.
Thank you, sir, and congratulations to Burjeel Royal Hospital once again. The second winner for this category is International Modern Hospital. International Modern Hospital, established in 2005, is a tertiary multi-specialty hospital with state-of-the-art facilities and expertise in all specialties, and with capabilities of providing treatment to all types of medical and surgical emergencies. What sets them apart is the unrivaled legacy in keyhole surgeries, where they are seen as the preferred referral partner for complex keyhole surgical cases in the region. In addition, their 24/7 care across key specialties is another pillar that differentiates them from the rest. I request Ms. Ramya Venugopalan, GM of Operations and Quality, to kindly share her experience.
Very good afternoon to all of you. First of all, I would like to thank the WMC for recognizing us under this category. Of course, it is very much, we are very delighted to receive this award, and we feel good and motivated whenever hard work is appreciated in this form. Although we are receiving this award, but truly it is the entire team of IMH, their commendable work has resulted in this form of recognition, and they have stood by and taken patient as their first and foremost priority, because of which our patients have been highly satisfied, even though during this crisis and tough time. Thank you once again, the entire IMH team and WMC, for recognizing us. Thank you.
Thank you, Ms. Ramya, and congratulations to International Modern Hospital once again. The third winner in the Excellence in Patient Satisfaction category is Health Bay. Health Bay opened its very first clinic in 2008 and is dedicated to providing the highest level of medical care to its patients using state-of-the-art technology for diagnostics, prevention, and treatment. From initial contact onwards, the patients will be assisted and they're supported by their friendly team of experiences and dedicated healthcare professionals. Their experienced and renowned medical professionals will create a personalized health plan aimed at addressing individual health concerns. This will include a comprehensive checkup, allowing them to help establish a starting point regarding your physical condition. Let me invite Dr. Rajashekar Guju, CEO of Anglo-Arabian Healthcare, to kindly share a few words.
Thank you to WMC for considering us for this award, and it's a great honor for us. I would ask my colleague, Ms. Nesreen, who is HR Director and been working in this organization for 10 years, to say a few words.
Hello, thank you so much for this award and recognition. We really very happy to take part of this competition. It was a very difficult, challenging time, but we wouldn't have been able to make it without the guidance of Dr. Raja, our CEO, and our staff. So thank you so much.
Thank you, and congratulations, Health Bay, once again. Most Valuable Corporate Response is our next award category, and the winner is Amina Hospital. Amina Hospital is a premier hospital based in Ajman, offering a high standard of ethical primary healthcare services in a caring environment. A division of Anglo-Arabian Healthcare, Amina Hospital was established to provide world-class medical and surgical expertise throughout the United Arab Emirates, utilizing a combination of the latest technologies and the skills of talented medical specialists. Congratulations, and let me invite Dr. Raja once again to share his thoughts.
Thank you very much. It's a great honor to receive this award on behalf of all the staff who contributed for fighting this big battle against the COVID-19 pandemic. It's a great honor to receive this award from WMC. I thank the jury for considering us for this prestigious award. Thank you very much.
Thank you, sir, and congratulations to Amina Hospital once again.
Thank you.
Moving on to our next category, Most Valuable Medical Innovation. The winner of this category is Open Mind Psychiatry Counseling and Neuroscience Center. Open Mind Psychiatry Counseling and Neuroscience Center is the leading psychiatry counseling and neuroscience center in Dubai, focusing on children, adolescents, adults, and senior citizens with mental and physical health concerns. Their highly qualified professionals take pride in serving the community with best interests in patient-oriented high-quality care and educating the individuals to reach their highest potential and living their life to the fullest. Congratulations! I request Dr. Shankar Srinivas, the Medical and Managing Director, to kindly join us to share a few words.
Hello.
Yes, Dr. Shankar, we can hear
Yeah,
you.
can you see me? Can you hear me?
I can hear you, doctor, but I'm unable to see you. Requesting you to kindly switch on the video.
Yeah, it's switched on already.
If you could try once again, doctor. No worries, doctor. You can continue. We can hear you. I think he quickly logged off to join back in again. So kindly bear with me for a few minutes.
Don't use a Zoom. I'm still on that. Hello.
Yes, Dr. Shankar, we can hear you.
I'm so sorry for the confusion,
That's absolutely all right, doctor. We can hear you, doctor. Please continue.
First of all, thank you so much on behalf of the Board of Directors and entire team at Open Mind Center. We'd like to thank World Medical Council, also the jury for accepting our nomination. I think it has been a challenging and quite a tough time for us in the last 1 year. We at Open Minds, both our clinicians and frontline staff, we were able to really navigate through these challenges, and it could be online therapy sessions, online consultations, or free social media campaigns to motivate the clients to take up the online sessions, and increasing their response in regards to providing more morale and also support. So on behalf of the entire team at Open Minds, we'd like to really thank everyone, and I hope everything goes well in the coming. Thank you so much.
Thank you so much, sir, and congratulations to Open Minds and Psychiatric Counseling and Neuroscience Center once again. The Best Medical Center is our next award category, and the winner is Sama Medical Group. The Sama Medical Group comprises of the Sama Fertilization Center, is a state-of-the-art center in the heart of Dubai that offers couples the best chance of conception in a supportive and caring environment. They aim to routinely offer cutting-edge assisted reproductive technologies and ensure that each of the patients receives personalized care in a comfortable clinical setting, cost-effectively. May I invite Dr. Shahid Al-Sadi to kindly speak a few words.
Thank you so much. Thank you. On behalf of the chairperson, Dr. Noel Abbasi, we are honored to receive this award, and I would like to thank the leadership of the government in UAE and the Dubai Health Authority especially for their guidance and support during the pandemic. And of course, I would like to thank the WMC and Dr. Sohan for this opportunity and event. And of course, I would like to appreciate the efforts of my staff who made our operation be very smooth. Thank you so much.
Thank you, ma'am, and congratulations to Sama Medical Group once again. Our next award is for the Best Healthcare Insurance Provider, and the winner is Oman Insurance. From innovative online solutions to quick and efficient claim payments, Oman Insurance put customers at the heart of everything they do. They work with a vision to provide outstanding insurance solutions that help create and protect wealth and well-being. Their financial stability, coupled with their award-winning service, makes them the insurer of choice for over 830,000 customers. I request Dr. Smita Rai, Head of Life and Medical Claims, to kindly share a few words with us.
Good evening, everyone. And on behalf of Oman Insurance, I thank the jury and the World Medical Council for this huge honor. This award is a reflection of the impactful role Oman Insurance as a company plays in the lives of the customer and the community in general. Customer satisfaction is very important for us at Oman Insurance, and we look forward to continuing to strive towards improving our services in order to ensure it. Thank you once again for this honor and the prestigious award. Thank you.
Thank you, ma'am, and congratulations to Oman Insurance once again. Now for our last award of the evening. It is the Best Hospital Award, and the winner is LLH Hospitals. The LLH Hospital was born out of a desire to provide cost-effective yet specialized and superior quality healthcare services, complemented by personalized healthcare and individual attention to each patient, with an unparalleled passion and commitment to serve the medical needs of the growing population of the Emirate of Abu Dhabi. LLH Hospital has over the years become the hospital of choice to citizens and residents of Abu Dhabi through the sincere dedication of their medical staff in attending closely to each of their patients' needs with compassion, respect, and dignity. We invite Dr. Narendra Sonigra, Director of Operations, to kindly speak a few words. Dr. Narendra, can you hear me?
Yeah, I can hear.
Sir, requesting you to kindly switch on the video, please.
It's already on.
No worries, sir, then. Please continue.
It's okay. Once again, thank you very much, WMC jury, for recognizing and rewarding our hospital. It will surely motivate all our team members. We are extremely thankful to WMC jury. We are extremely thankful to Department of Health, who have been so proactive in containing this disease, and we are thankful for all our teammate and associate who supported so well during the COVID pandemic, and because of which we could able to treat tens of thousands of patients with COVID. We are extremely proudful that we are being part of the governing body with support to whether it comes to screening or whether it comes to COVID treatment or whether it comes to COVID vaccination. So once again, thank you, and we are happy to receive this. Thank you very much.
Thank you, sir, and congratulations to LLH Hospital once again. Excellence in Community Involvement was the award, the category, and our winner was Meteor 24/7 International Hospital. We have Dr. Asif Ghani, the Director of Operations, with us. Requesting you to kindly speak a few words, sir. Dr. Asif, can you hear me?
Hi.
Sir, requesting you to kindly.
Good evening, everyone.
Yes, sir.
My video is on.
Yes, sir.
Thank you very much. Thank you, World Medical Council. Hello, can you hear me?
Yes, sir. Sir, lost you in between, sir.
Sorry. Thank you very much, World Medical Council and the jury members. I very humbly accept the award on behalf of the team members, the doctors, the nurses, the paramedical staff, the admin staff, and not to forget the facility and the housekeeping staff, which helped us in mobilizing everything, and the HR, who was at the forefront in mobilizing the staff. And thank you to the visionary leadership of our CMD, Dr. Shamsheer Vayalil, who ensured that there was uninterrupted supply of not just the PPEs, but of all consumables. And he was there with unrelenting care and follow-up for all the staff. Thank you very much for the award.
Thank you, sir, and congratulations once again. So congratulations to all the winners.
Thank you, ma'am.
With this, we have come to the end of our program. I congratulate all our award winners today and thank you for joining us for this virtual show. We hope to soon mitigate these tough times and usher in a new era of hope and possibility. Thank you all once again. Stay safe and stay healthy.
Greenwich 151432.
This is Greenwich, go ahead.
Inbound 81-year-old female patient.
The modern healthcare industry is divided into many subsectors. Depending on the multifaceted teams of trained professionals, marketeers to investors and shareholders of for-profit services, all